When a child is choking, they will exhibit choking signs such as having their hands clutched to the throat, inability to speak, difficulty in breathing, bluish skin color, and loss of consciousness if the blockage is not cleared. So, this is what you should do. First, ask the child, "Are you okay? Are you choking? Can you cough it out?" and encourage them to cough to dislodge the object. Bend the child forward at the waist and give 5 back blows between the shoulder blades with the heel of one hand. If this does not work, stand behind the child and locate the belly button. Wrap your arms around the child's waist and place a fist with the thumb side against the middle of the child's abdomen just above the belly button and below the edge of the breastbone. Cover your fist with the other hand and give 5 quick upward and inward abdominal thrusts. If that one is not successful, continue sets of 5 back blows and 5 abdominal thrusts until the object is forced out and until the kid can possibly cough and breathe and becomes unconscious. If the child is still choking after 5 repeated sets and if the child becomes unconscious, call 999 if not already done. If the child is found unconscious and has stopped breathing, we will commit CPR. We want to make sure that we begin with assessment. Make the child comfortable by laying the child on the bed or lower the child to the ground. Carefully place the child on their back to avoid any spinal injury. Open airway by tongue jaw lift to look for the object. If seen, remove manually with your fingers. If not seen, start CPR. However, do note that the object is removed only if clearly visible and easy to reach. Activate emergency medical service and have someone call 999. "Hey you, in the brown shirt, go call 999. I've got a child from conscious to unconscious choking. I need an ambulance, please come back as I need your help." After the EMS is activated, look and listen for breathing for a maximum of 5 to 10 seconds. The child is still not breathing. Next, check for pulse. If there's no pulse, follow CPR sequence. To do chest compressions, we are going to place one hand at the center of the chest. Search for the sternal arch and move downward slowly until you reach the midline of the body in between 2 nipples. Draw an imaginary line between 2 nipples and just below the line, place the heel of one hand on the breastbone and start to compress. Keep the arm straight and press 1/3 to half the depth of the chest. Give 30 compressions quickly. Open the airway by lifting the chin up and tilt the head by pushing down on the forehead with the other hand. Open airway by tongue jaw lift to look for the object. If seen, remove manually with your fingers. If the child is still not breathing, cover the child's mouth tightly with your mouth and pinch the nose closed. Keep the chin lifted and head tilted. Give 2 rescue breaths. If the child still does not have normal breathing, coughing, or any movement after 2 minutes, repeat rescue breathing and chest compressions until the child recovers or help arrives. If the child starts breathing again, open the child's mouth and try to look for the object. If you see the object clearly, try to remove it with your fingers. Place her in a recovery position. Keep checking for the pulse and the blood pressure after the child has regained consciousness.